Hi, I'm Eric Glass, and welcome to Work Talk, where we talk about the most important issues facing your business with some of the smartest minds in the business. And today we're talking about uncertainty in the healthcare industry and what healthcare leaders can do to not only survive, but also thrive in these turbulent times. With me today, we have Michael Evangelides, principal at Deloitte Consulting, and Walter Porter, also a principal at Deloitte Consulting. Walter, welcome back.
Thank you.
Michael, welcome to the show.
Pleasure.
Excited for this topic. So obviously a lot happening on the political and legislative front. How would you characterize the general feeling out there in the healthcare industry? Michael, why don't we start with you?
Yeah, I think I would say uncertainty. President Trump campaigned on changing the ACA, and so many in the industry are waiting to see what that really means.
Regardless of who's in office, I think we as a country and the leaders of our country are saying healthcare as we have known it for so long is just not sustainable given how much of our GDP it really comprises, right? That percentage of GDP and what changes have to come about. I think change is the new norm when it comes to healthcare, really.
Yeah, well, and as you noted, the ACA has certainly been a very central topic. Let's go a little bit deeper and just talk a little bit more to that.
One thing it did, I actually think has been very beneficial and will be very beneficial, is whether you like the legislation or not, it was the motivator for change in the industry, in an industry that needed change.
Yeah, right.
Under the ACA, we've insured 20 million or so people that weren't insured before, and I don't see how we can just drop them from the insurance rolls. So hopefully that'll continue on.
Well, so let's look at some other changes impacting healthcare. What do you see happening around MACRA?
Yeah, MACRA is the Medicare Access and Reauthorization Act.
That's a very sexy name.
It is very sexy, isn't it? It was passed with significant bipartisan support. Essentially what it does is it takes Medicare reimbursement and it moves it from a process that worked in a fee-for-service world to something that is much more accommodating in a value-based care world. It focuses on reimbursement for physicians on outcomes and on quality. It starts to be put in place in 2018, and it actually requires a fair amount of work for providers and physicians, upfront work for them to do now. How do they measure, outcomes and quality? What does their cost structure look like? It will continue to really push the healthcare industry to value-based care.
Well, so it sounds like then, there's a interesting combination of both hope around it, but maybe also still some fear there.
Yeah, I think there are a number of organizations that still don't quite understand what it means for them in this world of MACRA and what it will mean for them. It could mean some pretty significant differences for each organization. So the hope is certainly there, but I think uncertainty, fear of the unknown is also out there.
What do you advise healthcare clients to do in the context of all this uncertainty? Walter, let's start with you on that.
It's important for our clients to think about new streams of revenue or new segments of their patient/customer base. And I use the word customer very precisely in that we so long have thought about just that this is a world of patients, but really start to think about patients as customers and the consumerism of healthcare. I think about this. We're starting to see these new service lines pop up. So one example is sports medicine for youth athletes. We're starting to see sports clinics just for kids, and it's around preventative care, either from concussions occurred in soccer or kids that are tearing ACLs and detaching MCLs. But there's a market for that going on now, and that's just an example of new service lines that our clients and that health systems are starting to go after.
Yeah, new services, new markets, different care models, new technology that's disrupting how healthcare is delivered, and they're here, they're coming, and they're going to increase.
Yeah.
I think what it does say is one thing that healthcare organizations probably need to do a better job of and focus on is being much more agile. I think a lot of agility has to do with your employee base, your engagement of your employees, your development of employees, such that you've got people that understand that change is just part of what's going to happen in healthcare going forward. And let's be comfortable with that and not fight it, because there is no fighting it.
Right.
Yeah, I mean, to that point, Mike, you think there's already clinical and nursing shortfalls going on in the country today. So the ability to attract and retain talent is going to be very important, and it gets back to that aspect of consumerism. I think as patients hear about long ER wait times, that's probably because there is a nursing shortfall somewhere. They're going to take their care somewhere else, right?
And we know that a more engaged employee base, there's data to support this, leads to better outcomes and higher patient satisfaction.
Yeah, fair enough. Well, so on the other side of agility and some of these sort of innovative new approaches that are happening, which frankly are kind of mind-boggling, what do you say to clients to help them fight do nothing or inertia?
Yeah.
What do you counsel there?
That's a big part of our job, right?
Yeah.
First of all, I believe strongly that not doing anything, there's uncertainty out there, so we're just going to stand pat, we're not going to do anything. That just means automatically you're going to fall behind, because there are others that are going to continue to push forward. What we try and do, kind of getting back to MACRA, for instance, there are models that you can run that look at your financials, look at your Medicare base, look at your quality scores, and can determine whether, how well you're going to do in the future. And so if you're highly profitable, but don't change anything over the next 5 years in a world of MACRA, you're going to be much less profitable.
Yeah.
If you're not very profitable today, over the next 5 years, you're likely going to be running, a deficit or a significant deficit, and it's obviously problematic. So running those different scenarios can be very instructive, very eye-opening, and in almost all cases, it pushes an organization to act. Some of them have to act in a large way, quickly.
Yeah, we're not talking about a wide spectrum of margin either. I mean, if you're 2 to 3% margins, we have clients that live there, and they're watching the books and their spend very closely. You're probably struggling, to keep I wouldn't say keep the doors open, but you're very much watching business on probably a bi-weekly to monthly basis. If you're in that maybe 4 to 6 or 7 range of margin, you're okay, looking for ways to do business better. And if you're north of 7, you're actually doing pretty well from a financial perspective. Obviously, we have clients that are much higher than that, but really think about that spectrum is 3% to about 7%. So we're talking 4 basis points in an environment where uncertainty is the new norm.
Well, that's certainly a lot to digest. But Walter, let me come back to you on this one. What else is on the minds of healthcare leaders, just in the context of all these things going on?
Yeah, I think with all the consolidation going on, leaders are asking themselves, where are they going to be as a system and probably even individually over the next 5 years? You're probably looking down, am I the acquiree, or is someone, or am I looking to acquire someone else?
I agree. And I've done a fair amount of work with academic medical centers. There is a concern there. They have this extra burden of not just patient care, but medical education and medical research. And with that comes additional cost. And in a world where, reimbursements are getting smaller and you really do need to focus on cost, I think there's a question of how will they do and how will they fare? And it's important to all of us, because that's where so much of our medical innovation comes from.
Well, we've covered some good ground here. If you were just to kind of summarize, or just a little bit of advice, your parting shot, what might that be? Walter, why don't we start with you?
Yeah, I go back to really thinking about patients as customers. And I think all too often health systems are so regional based, and they think they have a lock on that region or that city or those set of blocks in which they they sit, and that's going to change. I know that leads to something you're very passionate about, which is talent, but really focusing on patients as customers, and how do you retain them, and how do you meet the needs that they don't even foresee themselves needing just yet.
There's a holy trinity of things that no matter what happens, providers can and should focus on, and that is taking care of the patient and being more service-oriented for their patients, taking care of their people, better engagement, better development of their people, because there's statistics that actually show a more engaged workforce will lead to higher patient satisfaction. And then finally, cost. And in particular, when we talk about cost, understanding the ramifications and the impacts of MACRA. It doesn't matter what the legislation ends up being. If you focus on those things, that will serve you well.
Well, there it is. Michael, Walter, very much appreciate the time. It's been a great conversation. We've been talking about the healthcare industry and navigating these uncertain times and what leaders can do to not only survive, but thrive. Thanks for joining another episode of Work Talk. That jab.
Yeah.
Spike the
My
ball.
leg is dead.
Boom!
My leg is
Spike the
dead.
ball.